Hello, everyone, and welcome to Module 2, Physical Therapy and Mobility in Multiple Sclerosis. This session is designed for adults living with MS, caregivers, and professionals who support them. Today, we will look at how MS can affect movement, balance, strength, coordination, endurance, and confidence. We will also discuss how physical therapy, safe exercise, pacing, assistive devices, and simple environmental changes can support independence and quality of life. The central message of this session is simple. Movement matters, but it must be safe, individualized, and sustainable. The goal is not to push the body to exhaustion or to compare one person with another. The goal is to find the safest, useful amount of movement for each person. Please remember that this is an educational session. It does not replace an individual assessment by a physiotherapist, neurologist, occupational therapist, or another qualified healthcare professional. Participation in any practical activity is optional, and you may rest whenever needed. This module is organized into 6 connected areas. First, we will understand how MS can affect movement and why symptoms can change from one day to another. Second, we will discuss why physical activity matters. We will distinguish helpful activity from overexertion and explain why consistency is usually more valuable than intensity. Third, we will examine common mobility challenges such as weakness, stiffness, spasticity, balance difficulties, changes in walking, coordination problems, and fear of falling. Fourth, we will explore the role of physical therapy and the basic principles of safe exercise. Fifth, we will focus on strength, flexibility, balance, coordination, and fatigue management. Finally, we will connect mobility support with real daily tasks, assistive devices, home adaptations, self-monitoring, and a realistic personal movement plan. MS can affect movement in many ways. A person may experience muscle weakness, reduced balance, changes in walking, fatigue, stiffness, slower reactions, or reduced confidence. These effects can be mild, moderate, or more significant, and they may fluctuate. Because symptoms vary, mobility support must be flexible. A routine that works well today may need to be shortened or adapted tomorrow. Adaptation is not failure. It is a normal part of managing a variable condition. The phrase on the slide, "Movement matters, but it must be safe, individualized, and sustainable," will guide the entire session. Safe means that the activity respects fall risk, symptoms, temperature sensitivity, and the environment. Individualized means that the plan fits the person's abilities and goals. Sustainable means that the routine can be repeated without causing repeated exhaustion. Our learning goals are to understand physical changes, recognize the role of rehabilitation, apply safe principles, and connect movement with fatigue management and independence. MS affects the central nervous system, which includes the brain and spinal cord. These structures help coordinate the signals needed for movement. When communication along these pathways is disrupted, movement may become slower, less efficient, or more difficult to control. Common effects include muscle weakness, reduced balance, changes in walking pattern, stiffness or spasticity, fatigue, reduced endurance, coordination difficulties, and slower physical responses. Not every person will experience all of these effects. Even when 2 people have the same diagnosis, their mobility needs may be very different. One person may mainly struggle with fatigue, while another may have difficulty with balance or foot clearance. This is why a single standard exercise program cannot suit everyone. A useful plan must consider current function, safety, personal goals, home environment, confidence, and how symptoms respond after activity. It is also useful to focus on function rather than only on symptoms. Instead of asking only, "How strong is this muscle?" we can ask, "Can the person stand from a chair safely, turn in a narrow space, or reach the bathroom with enough energy?" Variability is a defining feature of MS. A person may feel stronger and more stable on one day and much more limited on another. Heat, stress, poor sleep, illness, fatigue, medication effects, or relapse-related changes may influence performance. A flexible movement plan does not demand the same performance every day. It may include a full version, a shorter version, and a seated or recovery version. This allows the person to remain active without ignoring the body's signals. The reflection questions on the slide help make movement personal. What movement is realistic and meaningful for me now? Which physical changes affect my daily life most? Do my symptoms stay stable or do they fluctuate? Physical and emotional well-being are closely connected. Fear of falling may lead a person to avoid walking. Reduced activity can then cause deconditioning, lower confidence, low mood, and social isolation. The cycle can reinforce itself. In the opposite direction, safe and meaningful movement may support confidence, routine, self-efficacy, and participation. The aim is not simply to exercise more, it is to make movement feel safer and more useful. In the past, people with MS were sometimes advised to avoid exertion. That general approach is now considered outdated. Appropriate physical activity is recognized as beneficial when it is adapted to the individual. Regular activity may support balance, walking ability, endurance, physical function, fatigue management, and quality of life. It may also help maintain confidence and participation in ordinary routines. However, promoting activity does not mean pushing people beyond safe limits. The goal is not exhaustion. The goal is gradual progress, maintenance of capacity, and protection of independence. For some people, progress may mean walking farther. For others, it may mean maintaining current function, standing more safely, or completing a transfer with less effort. Maintenance is also a meaningful outcome, especially in a long-term condition. Short and repeatable routines are often more useful than intense programs that create several days of recovery or cannot be continued. People often believe that exercise must be long or intense to be valuable. For adults with MS, regular manageable activity may be much more effective than occasional maximum effort. Overexertion can be counterproductive when fatigue, heat sensitivity, pain, or symptom fluctuation are present. If a session leaves a person unable to complete essential activities later, the program may need to be adjusted. The examples on the slide show that meaningful activity can be brief. 10 minutes of seated exercise, short walking intervals, supported balance practice, or stretching at the same time each day. The important question is not, what is the maximum I can do today? It is, what is the safest, useful amount that I can recover from and repeat? Progress can be made by changing only one element at a time. For example, adding 1 repetition, 1 minute, or 1 short session. Gradual changes make it easier to observe how the body responds. Here, we see 6 common mobility challenges. The first is muscle weakness. Weakness may reduce walking speed, make stairs more difficult, or make standing from a chair harder. The second is spasticity or stiffness. Spasticity refers to increased muscle tightness or involuntary muscle activity. It can affect comfort, posture, movement efficiency, and walking. The third is balance difficulty. This may be especially noticeable when turning, using stairs, carrying objects, walking in low light, or moving on uneven surfaces. The fourth is walking difficulty. A person may take shorter steps, walk more slowly, have difficulty clearing one foot, or fatigue quickly. The fifth is reduced coordination. Tasks may feel clumsy, poorly timed, or difficult to sequence. Combining actions, for example, walking while carrying something, may become harder. The sixth is fear of falling. Fear can be protective when it encourages caution, but excessive fear may lead to avoidance. Avoidance can reduce strength and confidence, increasing future risk. A good assessment tries to identify the specific problem. I have trouble walking may involve weakness, balance, stiffness, fatigue, footwear, vision, the environment, or several factors together. Physical therapy is not only for a severe problem or for recovery after an injury. In MS, it can help maintain function, improve movement efficiency, manage secondary complications, and support independence over time. A physiotherapist may assess strength, balance, walking, posture, transfers, flexibility, endurance, fall risk, and the way fatigue affects movement. The therapist can then recommend exercises and practical strategies. Support may include strength work, gait training, stretching, balance exercises, transfer practice, fall prevention, spasticity management, and adaptation of activity. Early assessment can be valuable because difficulties are sometimes easier to address before they become established habits or lead to repeated falls, inactivity, or loss of confidence. An occupational therapist may focus more directly on daily tasks, energy conservation, equipment, and adaptations at home or work. The professionals may work together. The key principle is individualization. Two people who appear similar may need different plans because their fatigue, fall risk, symptom pattern, confidence, environment, and goals are different. Physical therapy goals are most useful when they are specific and connected to daily function. Short-term goals may include standing more safely, walking more steadily indoors, learning a home routine, or reducing stiffness. These goals are concrete and can often be observed in everyday situations. Long-term goals may include maintaining independence, protecting endurance, reducing inactivity, improving quality of life, and sustaining participation in daily routines. A goal such as improve mobility is very broad. A more practical goal might be stand from the living room chair using the armrests with better control there, or walk from the bedroom to the bathroom safely with the recommended support. Goals should also be reviewed. If symptoms, priorities, or circumstances change, the plan may need to change. Adjusting a goal is not giving up, it is keeping the plan relevant. Safety begins with gradual progression. Start with an amount the person can manage and observe how the body responds during the activity and afterward. Monitor fatigue and allow recovery. Use stable support surfaces when balance is uncertain. Keep walking routes clear. Wear appropriate footwear, and avoid unsafe environments. Hydration and temperature are also important. Some people with MS notice temporary worsening of symptoms when they become overheated. Activity may need to take place in a cooler environment, at a cooler time of day, or with additional breaks. Stop and reassess if there is sudden severe dizziness, sharp pain, unusual weakness, unsafe instability, overheating, distress, or symptom worsening that does not settle. New, sudden, or concerning symptoms should be discussed with an appropriate healthcare professional. Exercise should challenge the body enough to be useful, but not so much that technique becomes unsafe. Quality and control are more important than completing a fixed number of repetitions. Finally, do not compare programs. The safest plan is based on the individual, not on what another person with MS can do. A balanced movement plan may include 4 core areas: strength, flexibility, balance, and coordination. Strength exercises may include controlled sit-to-stand practice, supported mini squats, heel raises, seated leg extensions, or resistance band exercises. The correct choice depends on ability, technique, and safety. Flexibility exercises use slow, comfortable movements to maintain range of motion and reduce stiffness. Stretching should not be forced or painful. Balance exercises may include controlled weight shifting, supported standing, turning practice, or stepping near a stable surface. A person at risk of falling should not practice challenging balance activities alone. Coordination activities may involve alternating limb movements, controlled reaching, movement sequences, or eye-hand tasks. These areas overlap. For example, standing from a chair requires strength, balance, coordination, and confidence. Functional tasks often train several systems at once. MS-related fatigue is not simply laziness or lack of motivation. It can be intense, unpredictable, and out of proportion to the activity performed. A useful mobility plan respects fatigue without encouraging complete inactivity. This balance is achieved through pacing and energy conservation. Pacing means breaking tasks into manageable parts, resting before exhaustion becomes extreme, planning demanding activity at a better time of day, reducing unnecessary movement, and combining effort with recovery. The words on the slide, prioritize, pace, rest early, and adapt tasks, can be used as a daily decision tool. Ask, what truly needs to be done? Can the task be divided? Can it be done seated? Can equipment, organization, or help reduce unnecessary effort? Resting early is important. When a person waits until all energy is gone, recovery may take longer and important activities may become impossible later. Energy conservation is not about doing nothing. It is about using limited energy for the activities that are necessary or meaningful. Mobility support is most meaningful when it helps with real tasks, getting in and out of bed, sitting and standing, walking indoors, turning, using stairs, dressing, bathing, or carrying objects. Sometimes a person does not simply need more exercise. They may need a better movement strategy for a specific task. For example, standing from a chair may become safer by choosing a stable chair of suitable height, placing the feet well, moving toward the edge, using the armrests when recommended, and rising with controlled forward movement. Walking from the bedroom to the bathroom may improve through better lighting, a clear route, appropriate footwear, a support device, and planned rest, not only through leg exercises. Functional goals protect dignity because they focus on what the person wants and needs to do. A small improvement in one essential task can have a large effect on confidence and independence. Caregivers should support rather than take over automatically. The aim is to provide the amount of help needed while preserving the person's participation and choice. Using a cane, walker, handrail, shower chair, or another support tool is not a sign of failure. It may reduce fall risk, protect energy, improve confidence, and help a person remain independent. The important issue is correct selection and correct use. A device that is the wrong height, used on the wrong side, or poorly maintained may create new problems. Assessment and training by an appropriate professional are recommended. Environmental adaptations may include handrails, improved lighting, removal of loose rugs and clutter, stable seating with armrests, bathroom supports, and a furniture layout that creates clear walking routes. The best adaptation is often a small change that reduces repeated risk. For example, placing frequently used objects within easy reach can reduce unnecessary bending and carrying. Adaptation should not make a home feel like a hospital. The aim is to improve safety while respecting comfort, identity, privacy, and dignity. A useful movement routine should be realistic, safe, flexible, repeatable, and meaningful. The most effective routine is not necessarily the most impressive one. It is the one that can be continued. The sample structure on the slide includes short strength sessions, mobility or balance sessions, daily stretching, walking, or seated activity as tolerated and planned recovery. This is an example rather than a prescription. The appropriate frequency, intensity, duration, and type of activity depend on health status, symptoms, experience, fall risk, and professional guidance. A flexible routine may use 3 levels. A green day plan is the usual routine. An amber day plan is shorter or more supported. A red day plan focuses on gentle movement, positioning, recovery, or professional advice when symptoms are concerning. Routine also becomes easier when it is linked to an existing habit. For example, a short stretch after breakfast or a seated movement sequence before an afternoon rest. Only one element should be increased at a time. This helps identify whether the change is manageable. Self-monitoring helps connect activity with symptoms and daily function. It is not meant to create anxiety or constant checking. It is meant to identify useful patterns. The reflection prompts: ask, which movement feels hardest? What makes it harder? What makes me feel safer? Am I doing too little, too much, or something sustainable? When is my best time of day for movement? Simple tools may include a daily fatigue score, a walking confidence score, notes about falls or near falls, a weekly movement diary, and observations about symptom changes after activity. A useful diary is brief. For example, activity, duration, effort, symptoms during the activity, and how the person felt later that day or the next morning. Near falls are important information even when no injury occurs. They may reveal problems with turning, footwear, lighting, rushing, fatigue, or the need for assessment. These observations can improve communication with professionals and caregivers. Instead of saying, "Exercise makes me tired," a person may be able to explain, 10 minutes is manageable, but after 15 minutes, my walking becomes less stable. Physical activity can be beneficial for people with MS when it is apo-adapted appropriately. Adults with mobility difficulties or fatigue should generally be supported to remain active within safe and realistic limits, rather than being encouraged toward unnecessary inactivity. Physical therapy can support strength, balance, flexibility, walking, transfers, confidence, and participation in daily life. Fatigue management and energy conservation are central to safe mobility. Rest should be planned before complete exhaustion. Sustainable progress is more important than intensity or comparison. Maintenance of function can also be an important achievement. The goal is not perfect movement. The goal is movement that is safer, steadier, more confident, and connected to the person's own priorities. Physical activity and exercise can support people living with MS when they are adapted to the individual. Physical therapy can help improve or maintain strength, balance, flexibility, walking, confidence, and daily function. The goal is not perfection, maximum effort, or competition. It is sustainable and meaningful movement that protects independence and quality of life. A small improvement can matter greatly. Standing with more control, taking a safer turn, having enough energy for a valued activity, or accepting a support device that makes participation possible. I invite you to choose one practical action from today's session. It may be arranging a professional assessment, clearing one walking route, planning rest earlier, monitoring fatigue, or creating a short and flexible movement routine. Thank you for your attention and participation. Please remember that adapting movement to the body's needs is a sign of good self-management, not weakness.